Look, I'm afraid no responsible Prime Minister can ignore the message of those figures. And when I told you 2 weeks ago that we were pursuing a local and a regional approach to tackling this virus, I believed then, and I still believe passionately, that was the right thing to do. Because we know the cost of these restrictions, the damage they do, the impact on jobs and on livelihoods and on people's mental health. And no one wants to be imposing these kinds of measures anywhere. And we didn't want to be shutting businesses, pubs, restaurants in one part of the country where incidence was very low, when the vast bulk of the infections were taking place elsewhere. And our hope was that by strong local action, strong local leadership, we could get the rates of infection down where the disease was surging and address the problem thereby across the whole country. I want to thank the millions of people who've been putting up with these restrictions in their areas for so long. I want to thank the local leaders who've stepped up and local communities, because as you can see from some of those charts, you know that the R has been kept lower than it would otherwise have been, and there are signs that your work has been paying off, and we will continue as far as we possibly can to adopt a pragmatic and a local approach in the months ahead. But as we've also seen from those charts, we've got to be humble in the face of nature. And in this country, alas, as across much of Europe, the virus is spreading even faster than the reasonable worst case scenario of our scientific advisors, whose models, as you've just seen, now suggest that unless we act, we could see deaths in this country running at several thousand a day, a peak of mortality, alas, bigger than the one we saw in April. And as you've just seen, even in the southwest, where incidence was so low and still is so low, it's now clear, though, that the current projections mean that hospitals in the southwest will run out of capacity in just a matter of weeks unless we act. And let me explain why the overrunning of the NHS would be a medical and a moral disaster beyond the raw loss of life. Because the huge exponential growth in the number of patients, by no means all of them elderly, by the way, would mean that doctors and nurses would be forced to choose which patients to treat, who would get oxygen and who wouldn't, who would live and who would die. And doctors and nurses would be forced to choose between saving COVID patients and non-COVID patients, and the sheer weight of COVID demand would mean depriving tens of thousands, if not hundreds of thousands, if not millions of non-COVID patients of the care they need. And it's crucial to grasp this, that the general threat to public health comes not from focusing too much on COVID, but from not focusing enough, from failing to get it under control. And if we let the lines on those graphs grow in the way that they could and the way that they're projected to grow, then the risk is that for the first time in our lives, the NHS will not be there for us and for our families. And even if I could now double capacity overnight, and obviously I'm proud that we have massively increased capacity. We do have the Nightingales. We've got 13,000 more nurses now than we had last year. We've got many more doctors. But it still would not be enough, because the virus is doubling faster than we can conceivably add capacity. And so now is the time to take action, because there is no alternative. And from Thursday until the start of December, you must stay at home. You may only leave home for specific reasons, including for education, for work, let's say if you cannot work from home, for exercise and recreation outdoors with your household or on your own with one person from another household, for medical reasons, appointments, and to escape injury or harm. to shop for food and essentials, and to provide care for vulnerable people or as a volunteer. I'm afraid non-essential shops, leisure and entertainment venues will all be closed, though click and collect services can continue and essential shops will remain open, so there's no need to stock up. Pubs, bars, and restaurants must close except for takeaway and delivery services. Workplaces should stay open where people can't work from home, for example, in the construction and manufacturing sectors. Single adult households can still form exclusive support bubbles with one other household, and children will still be able to move between homes if their parents are separated. If you're clinically vulnerable or over the age of 60, you should be especially careful to follow the rules and minimise your contacts with others. I know how tough shielding was, and we will not ask people to shield again in the same way, but we are asking those who are clinically extremely vulnerable to minimise their contact with others and not to go to work if they're unable to work from home. I'm under no illusions about how difficult this will be for businesses which have already had to endure such hardship this year, and I'm truly, truly sorry for that. And that's why we are going to extend the furlough system through November. The furlough scheme was a success in the spring. It supported people and businesses in a critical time. We will not end it. We will extend furlough until December. There will be some differences compared to March. These measures, above all, will be time limited. Starting Thursday, the 5th of November, they'll end on Wednesday, the 2nd of December, when we'll seek to ease restrictions, going back into the tiered system on a local and a regional basis according to the latest data and trends. Christmas is going to be different this year, perhaps very different, but it's my sincere hope and belief that by taking tough action now, we can allow families across the country to be together. My priority, our priority, remains keeping people in education, so childcare, early years settings, schools, colleges and universities will all remain open. Our senior clinicians still advise that school is the best place for children to be. We cannot let this virus damage our children's futures even more than it has already, and I urge parents to continue taking their children to school, and I'm extremely grateful to teachers across the country for their dedication in enabling schools to remain open. And it's vital that we keep provision for non-healthcare groups going. So please, and this is really important, unless your clinicians tell you otherwise, you should continue to use the NHS, get your scans, turn up for your appointments and pick up your treatments. If at all possible, we want you to continue to access these services now and through the winter. Indeed, it's only by taking this action that we can protect the NHS for you. On Monday, I'm going to set out our plans to Parliament. On Wednesday, Parliament will debate and vote on these measures, which, if passed, will, as I say, come into force on Thursday. We've updated the devolved administrations on the action we're taking in England and stand ready to work with them on plans for Christmas and beyond. We should remember that we're not alone in what we're going through. Our friends in Belgium, France, Germany have taken very similar action. And so, as we come together now to fight this second wave, I want to say something about the way ahead, because people will reasonably ask, when will this all end? And as I've said before, I am optimistic that this will feel very different and better by the spring. It's not just that we have ever better medicines and therapies and the realistic hope of a vaccine in the first quarter of next year. We now have the immediate prospect of using many millions of cheap, reliable, and above all, rapid turnaround tests. Tests that you can use yourself to tell you whether or not you're infectious and get the result within 10 to 15 minutes. And we know from trials across the country, in schools and hospitals, that we can use these tests not just to locate infectious people, but to drive down the disease. And so over the next few days, weeks, we plan a steady but massive expansion in the deployment of these quick turnaround tests, applying them in an ever-growing number of situations, from helping women to have their partners with them in labour wards when they're giving birth, to testing whole towns and even whole cities. The army has been brought in to work on the logistics, and the programme will begin in a matter of days. Working with local communities, local government, public health directors, organisations of all kinds, to help people discover whether or not they're infectious, and then immediately to get them, to help them to self-isolate and stop the spread of the disease. And I can tell you tonight that the scientists may be pretty uniformly gloomy about the immediate options that we face, but they are unanimously optimistic about the medium and the long-term future. We will get through this, but we must act now to contain this autumn surge. We're not going back to the full-scale lockdown of March and April. The measures that I've outlined are less prohibitive and less restrictive, but I'm afraid from Thursday, the basic message is the same. Stay at home, protect the NHS, and save lives. Thank you. I'm now going to go to questions from the public and then from the media. We're going to go first to Matt from Plymouth.
Quieter corners of the country, such as South East Cornwall, have very low incidence of COVID, but are we likely to see restrictions put in place in solidarity with the rest of the UK?
Well, thanks very much, Matt. Look, it's not solidarity with the rest of the UK, alas. It's not a gesture. What we're seeing, the numbers from the southwest, it's very clear that it's doubling there as well. And the pressure on the hospitals in the southwest is particularly acute. And we've got to recognise that although the incidence is low, it is growing in the southwest, and we need to tackle it. And we need to tackle it now. But Chris and Patrick, anything you want to add to that?
The only thing to add, Prime Minister, is just to reiterate, many of the areas which are lower have some of the highest rates of increase. And also some areas, including the southwest, are likely to get pressure on beds really relatively early because of the particular way that the NHS is constructed in those areas.
Thanks very much, Matt. Let's go to Alex from London. Alex from London asks, many graduates of 2020 are struggling to find work and having their internships and placements cancelled. What is the government doing to support graduates in accessing the labour market? Well, thanks, Alex. One of the many things that we're doing is the £2 billion Kickstart programme, which is designed to help 18 to 24-year-olds get into the labour market by supporting their employers to take them on with a contribution from government to the value of the living wage, and we hope that will be effective in what will unquestionably be tough months ahead. Kickstart amongst many other schemes that we're using to support young people get jobs across this country. I'm going to go now to, since that was obviously a question for me rather than for the scientists, I'm going to go to Laura Koonsberg of the BBC. Laura.
Thank you very much, and good evening, Prime Minister. You were told by your own scientists many weeks ago that you would have to take national action in order to save lives. Prime Minister, what took you so long? And to Professor Whitty and Sir Patrick, you've always been clear that taking early action would have the greatest chance of success in controlling the spread of this disease. Do you think that people may have lost their lives unnecessarily because of the delay?
Well, Laura, let me just answer your question by saying this is a constant struggle and a balance that any government has to make between lives and livelihoods, and obviously lives must come first, but we have to be mindful the whole time of the scarring, the long-term economic impact of the measures that we're obliged to introduce. So I do think it was right and rational to go for the regional approach. If we could have got the R down in those local areas in the way that we wanted to get it below 1. I mean, we came very close in some places. I think that would have been a great way forward. Alas, in common with many other parts of this continent, we've just seen an overall growth rate in the second wave, and it has made it absolutely vital to act now to protect our NHS and to save lives. And yes, it is true that the course of the pandemic has changed, and it's also right that the government should change and modulate its response in accordance. And I make absolutely no apologies for that. But I know there are other questions. Sorry.
Well, I mean, this is a horrible virus, and these are horrendous decisions to have to make. And, one shouldn't underestimate the impact of lockdown and all the other things that come along with that. There's no doubt from the purely point of view of the spread of COVID, the earlier you go in, the better. And so that is definitely the case for the spread of the disease. But of course, people have to take into account other things as well, and that's a matter for politicians.
Thanks very much.
Well, the only thing I'd add is, relative to other countries in Europe, some have gone earlier and some have gone later. France, for example, has actually gone arguably slightly later in terms of its epidemic curve. And these are very difficult judgments for every government. I would reiterate, though, the point just from a health point of view, many of the things that are involved have significant downsides. And therefore, we've always been having to, in the advice, walk the path of saying there are some very significant things you have to do early, but if you do them early, you also come at a very significant cost. And how do you balance those two across one another?
Thanks so much, Laura. Beth of Sky News.
Thank you. Prime Minister, you said recently a national lockdown would be a disaster, but many people watching this tonight will conclude that your failure to follow sage advice and the advice of the men standing by your side 5 weeks ago was now the wrong call. We face a longer lockdown, Christmas is in doubt, the NHS could be overwhelmed. Do you accept you should have followed the scientific advice more closely? And do you regret that you haven't? And if I could just ask Professor Whitty, many people will be watching this tonight, they will be very worried about what it means for them and their families, particularly going into Christmas. Realistically, is it now too little too late to get us to a place where we will be able to celebrate Christmas with our families?
Well, thanks, Beth. I just really repeat the point I made to Laura. We've obviously have to listen to all kinds of scientific advice, some of which tends in very much a different direction from some of the sage advice that you've seen. But we also have to balance that scientific advice with the consequences for people's lives, for people's mental health, people's livelihoods that comes from lockdown measures. And you've heard what David Nabarro of the World Health Organization, a very estimable epidemiologist, says about lockdowns. There's a range of advice, and there's a balance that we have to strike. I think I would just stress that we're not going back to we're not closing schools. It's very, very important that we're keeping schools open. Construction, manufacturing, we want to keep going. People, of course, should work from home. We want to minimise contact and get the R down, and that's the important thing. That's the way to protect the NHS. But I'm not going to pretend to you that these judgments aren't incredibly difficult. They are incredibly difficult, and we have to find the right balance, and we have to change with the changing pattern of the virus. And alas, what we're seeing now is a pretty consistent surge, not just in this country, but across many of our friends and partners in Europe. So we have to deal with it, Beth.
In terms of the timing, the idea that there is some perfect time to act is a complete misapprehension. There is basically no perfect time and there are no good solutions. All the solutions are bad. And what we're trying to do is have the fewest, the least bad set of solutions at a time which you actually achieve the kind of the balance that needs to be struck between all these things that ministers have to make decisions on. And in terms of making festivities, whether it's Christmas or any other religious tradition, we would have a much better chance of doing it with these measures than we would if these measures were not being taken today. And I think let us see how this goes over the next few weeks.
Thanks very much, Chris. Let's go to, and thanks, Beth. Let's go to Romilly Weeks of ITV News.
Prime Minister, thank you. The route out of the first lockdown was supposed to be local restrictions and test and trace. Now those have shown to be totally inadequate. Why do you think that they will help to get us out of a second lockdown? And
Well,
to the medical, if I may, do you believe a month of lockdown will be enough to allow families to be together at Christmas? And do you believe, like the Prime Minister, that things will be better by spring?
Well, Romilly, first on why I think the local approach remains the right approach, and what I talked about what we're going to do with the lateral flow testing, the mass testing, the LAMP testing, all kinds of testing that we're going to be already are rolling out. That works so well if you have local buy-in, local support, local organisations, local councils, public health directors, everybody involved together. And that the same applies to all the measures that we want to put in place. That's why the regional approach was right. One reason why the regional approach was right. Second reason is if the local approach was right. Second reason, as I say, when you have a situation in which, in a very big country with a huge population, you have very considerable disparities in incidence, it's logical not to treat the whole country the same. And you heard that point made by Jonathan Van Tam and others very recently. And I think that holds a lot of water. The trouble we've got, I'm afraid, Romilly, is that the local leadership and the local initiatives, the tiers they were in, they made progress. I mean, they did get the R down in the areas or lower than it would otherwise have been. No question. They made a huge, their sacrifices, their effort made a huge difference. And perhaps if we continued, that it really would have worked in those areas. The problem was that we were just seeing too many cases really taking off across the whole country, and it wasn't coming down fast enough in those most badly affected areas, and so you have to take a judgment, and we have to try now to get this thing, to get the R right under control with the measures that we're setting out. Then as I said, to come out of it in December, and hopefully people will have something a bit closer to a normal Christmas as a result. But more important than that, we will be able to spare the NHS and save a lot of lives, and that's the fundamental objective.
On the questions you asked me, I think if we did not act now, then the chances of the NHS being in extraordinary trouble in December would be very, very high. So in a sense, this is trying to make sure that December is not an impossible place for the NHS with large numbers of people infected and large numbers dying. I am, however, as the Prime Minister said, one of many scientists who are much more optimistic when we look forward to spring. And that's for multiple reasons, each one of which contributes a small amount. But the two biggest ones are, as the seasons move on, we all know that this is the late autumn and winter period is the period of greatest risk for respiratory viruses. That's true for everything, flu and many other viruses as well. And we expect that will come to our significant advantage when we come through to the spring, for lots of reasons, people behaving differently because they're outdoors more, open windows and so on, and temperature. But also, and importantly, there are now multiple shots on goal from science. And the scientific effort that is going on at the moment is absolutely unparalleled. From the UK, with enormous work done through the National Institute for Health Research and Medical Research Councils and Wellcome Trust and others, and the academic sector leading that work, also through many countries doing the same kind of activities, and all the pharmaceutical industry engaged. If you think about that body of work, it is steadily going to come on top of this infection, just as it has every infection we've had to date. And I think it is important always to remember that medical science is remarkably effective, but the area it has been most effective is in tackling infectious diseases. And which used to be the predominant cause of mortality, and they've now changed. So the expectation that science will bring forward large numbers of things which cumulatively will get on top of this, I think, is not an unreasonable one. That is what you would expect based on all previous experience.
And I think there are three concrete things to bear in mind of the advances in science. First, we now know one drug, dexamethasone, that reduces death from COVID in patients requiring oxygen in hospital. Second, vaccines are now in late-stage clinical trials, and there are many in late-stage clinical trials, showing an immune response. Doesn't mean they're all going to work, but it's a very important step along the way. Third, the new testing approaches, so the idea of faster near-person testing, which has been difficult up until now, and it wasn't certain that you get there, now looks real, as though that's going to come online. So those three things together are concrete, and you can see, therefore, the advances that are likely to come into play over the next months, and certainly by next year, in spring and beyond, you start to see the effects of some of those.
Thanks so much, Romilly. Thanks. Let's go to David Wooding's Sun on Sunday. David. Dave, you need to unmute. You need to unmute.
Mute.
Thanks.
Sorry, apologies. If this 4-week lockdown doesn't do the trick and you have to extend, what sort of length of time do you envisage? Another week, another 2 weeks, another 4 weeks? And could I perhaps ask Professor Vallance and Professor Whitty and Sir Patrick, whether they think that 4 weeks is enough or whether they were pushing for a bit longer? And the other thing I'd like to ask quickly is the Premier League matches, are they still going to be played throughout this period?
I can say yes to the Premier League, I think, with authority. David, on the, is the period up to 2nd of December going to be enough? I hope so. We have every reason to believe it will be, but we will be driven by the science, and we will look at where we've got to. I'm optimistic because as I said a couple of weeks ago, and I said again tonight, the R, although it's above 1, is not that much above 1. I think you looking at one of the slides that Patrick showed us earlier, it has been coming down. The trouble is, that still means the disease is doubling. If we can get it below 1, then, as you know, it starts halving, and that's where we want to get. And we think this package will do that, but we will be led by the evidence.
I think the key is getting the R really below 1 during this 4 weeks. So if we all do what we're supposed to do during this, the R will come down. If we can get the R well below 1, it starts to halve, and we end up in a much better position. But I don't think it's a situation where in 4 weeks' time you just say, well, everything's back to normal again, and there's going to have to still be some restrictions over the winter until the new measures come in spring and the new things come along. But 4 weeks with a really good reduction of R would make a big difference.
And just on the period coming up to, as it were, to December the 2nd, we will be looking very carefully at what's happening in the tiered areas and working out exactly which tier would be most appropriate as we come out of these tougher autumn measures. Let's go to Harriet Line of the Press Association.
Thank you, Prime Minister. What is your message to leaders in Scotland, Wales and Northern Ireland? Do you want them to follow your lead and introduce the same measures? And if not, are you considering restrictions on travel between the 4 nations? And to the scientists, Why are you confident that you won't need formal shielding this time around? And is there also a danger that hospitals could still be overwhelmed despite these new restrictions?
Well, thanks very much, Harriet. First of all, on the devolved administrations, the situation now is that there's quite a large degree of congruence between the whole of the UK, in the sense that Northern Ireland and Wales have very similar arrangements already to the ones we're announcing tonight. And Scotland, as you know, has its 5-tier system, which it also involves some pretty stringent measures to deal with fundamentally the same problem that we have across the whole of the UK, which actually we're dealing with in pretty much the same way. And as you know, every day there are constant discussions between the 4 CMOs, and certainly at a political level, constant conversations about how we're fighting this together.
Yeah, and just to reinforce that the 4 CMOs talk together very regularly to try and make sure that the science and the thinking is as aligned as possible. In terms of the shielding, which is your question specifically to us, we're not suggesting that people who previously were on the shielding list, the just over 2 million people who are on the shielding list, do not need to take extra precautions. They do. But we learnt a lot from the first time with the shielding programme. And some of the things worked, but some of the things did not. So what we're not aiming to do is to reproduce it. There were both some practical problems, and there was also the issue of people having significant problems with loneliness and feeling completely cut off from society. And what we're trying to do is try and avoid those downsides to shielding, whilst reinforcing the message that for people who are particularly vulnerable, they do need to take even greater precautions than the general public.
Right, well, that brings us to the close. Thank you very much, Harriet. Thank you, everybody, for watching. I just repeat those 3 rays of sunshine or of optimism that from our scientific and medical advisor, rather than from me. The prospect of ever better drugs, already dexamethasone, the realistic, though by no means certain, but realistic prospect of a vaccine, and then the hopes that and confidence that we're now placing in rapid turnaround testing that we're rolling out across the country. But in the meantime, we have to put in place these tougher measures for now until the 2nd of December across the country. And it goes without saying, everybody, don't forget the basics. Don't forget hands, face, space. Get a test if you have symptoms. Thank you all very much. Stay safe. Thank you.